Our entomology team, made up of Hannah Arnolds, Anna Burton, Ty Vu, Colleen Vu, Andrea Reina Macias, and Sue Amornstrack, have all found a way of stopping the spread of the Ochlerotatus punctodes. Ochlerotatus punctodes is a particular vector that has not been extensively researched, but through the research that we did, we found so much more. This vector was originally a subgenus of Aedes and has many similar characteristics, those that include also the way that they mate. Collectively known as a floodwater mosquito, they do not have a common name currently. The life cycle of the O. punctodes includes the 4 distinct life cycles that a mosquito goes through: egg, larvae, pupa, adult. Eggs must be flooded with water to hatch. The larvae takes a week to fully mature, and pupates emerge as an adult a few days later after the larvae has grown. Ochlerotatus punctodes has feeding habits that are not very beneficial to humans. They prefer to feed during the daytime, but this is the time when we are the most active, which increases our chance of spread of disease from these vectors. Humans are the preferred hosts, and mosquitoes are aggressively attacking us. CO2, or carbon dioxide, and lactic acid are indicators of a viable host. Release of anticoagulants by the hypopharynx in the mosquito cause antihistamine release, which causes swelling and itching at a bite site. This is what causes us to have those red bumps on our body after we have been stung by a mosquito. Ochlerotatus punctodes has created habitats that all mosquitoes do. They lay their eggs individually on moist ground right above waterline. There are a wide range of wet habitats, which include tires, ditches, cups, puddles, pastures, ponds, or irrigated fields. Any standing water is viable for egg laying. The mosquitoes prefer lots of leaves and twig coverage. This helps keep areas damp for their eggs. The eggs must be dried out and made wet again to hatch into larvae. Eggs take about 1 week after rain comes to enter pupal stage, and after this, they'll further go on to becoming an adult. Now moving on to susceptible human hosts. The geographical ranges found in Belgium, Finland, Norway, Russia, Sweden, and the United States, particularly Alaska, all have large bodies of water that border some part of the country. They have relatively stable water temperatures along the coast, and the cold does not impact breeding cycles of Ochlerotatus punctodes. The eggs will wait for warm temperatures and the water to warm up as well to hatch. The areas of exposure, which after further research have shown that are the ones that I have said prior, and also those with high density of forest on the kept grounds of moisture. Forests serve as an ideal breeding ground of Ochlerotatus punctodes because trees are able to hold large amounts of water in order to survive, which act as a primary area for the eggs to live in. All potential hosts are those in and around the geographical ranges for Ochlerotatus punctodes. All hosts of the disease visited either Ketchikan or Juneau, Alaska. These 2 places are closely located geographically and border the Tongass National Forest, which has a lot of pine trees. Patient 0 is suspected that was Leland McKee. He lived in Naples, Florida during cruise off season and Ketchikan, Alaska on a boat. He was a professional fisherman. Took tourism from cruise lines to land during the cruise season, and after a fishing excursion through European countries and Panama, it is thought that he contracted the disease and brought it back to Naples. Sadly, just like every other disease out there, this has classic flu-like symptoms, which include vomiting, nausea, muscle aches, body aches, and sometimes diarrhea. Muscle aches can lead to neck stiffening. Now, if the neck stiffenings are not treated in time, this can lead to death. The incubation period is about 16 to 24 hours after physical exposure. Most humans at risk include those with weakened immune systems, people in hospitals, older individuals over the age of 60, and children who have not received all their vaccinations needed to stay healthy. Pregnant women are also at high risk because they can become chronically ill and it can affect their fetus. We found that our reservoir is known as a common grackle. Grackles are a type of bird that breed across eastern two-thirds of Canada and the United States between the months of March and July. Their hatching time ranges from 12 to 14 days, and it has shown that the population of grackles has declined about 61% to an overall population of 73 million birds. Their habitats are included in agriculture fields, feedlots, city parks, and suburban lawns. They also tend to go into woodlands, forest edges, marshes, and meadows. People also find these types of birds around their habitats. The grackle's diet is considered to be very broad. They eat a wide array of foods, which include insects, small birds, frogs, berries, and grain. They also tend to feed on human refuge and are recently foragers. This is a large reason why they interact with humans as well. Their habitats overlap with humans in parks and suburban lawns in particular. They come into contact when feeding on trash left in human habitats, in the trash cans, or in the street. Bird feces can spread disease through contaminated water sources or through the droppings that are in the air. This can cause airborne spores when disturbed, and having direct contact of humans and birds can also cause spread. Fecal matter entering an open wound, cut wound, or a sore can be infected, which leads to contamination or disease spread. Grackles commonly harbor bacteria that does not cause self-harm or harm to other avian themselves, but they do vector Ochlerotatus punctodes. Their reservoir, the grackles, can contaminate the standing water areas where the mosquitoes have laid their eggs. Infected mosquito larvae will develop into adults carrying bacteria from the reservoir. This bacteria could have been spread by the fecal matter that could have dropped on top of the eggs or into the water that surrounds the eggs. Now moving on to our disease agent. We found that Listeria monocytogenesis was what caused for the patients to die. Our disease agent found in the Alaskan cruise line is of the scientific name Listeria monocytogenesis. Listeria has symptoms similar to those of the cold or the flu. This is a type of bacterium. As you can see on the slides, the genome size of the disease agent can be seen on the diagram. This is a gram-positive bacteria. It was found by doing a simple gram stain and the bacteria retaining the purple coloring. We have decided the common name is Alaskan cruise disease. As I had said before, the major symptoms of Listeria are common cold symptoms, which include vomiting, nausea, muscle aches, body aches, and diarrhea. The bacterial infection can cause death if not properly treated, such as with broad-spectrum antibiotics to make sure that we are getting the right type of bacteria. Patients presented with higher fever are generally feeling a little bit more ill with dizzy spells, and some present with low blood oxygen counts. After being admitted to the hospital, patients were put on an IV to treat with antibiotics, fluids, and steroids. All patients that presented with the infection succumbed to the infection within the following 14 days. So you might be asking, how do we plan to fight this disease? The patients that presented an infection from the disease agent did not survive the bacterial infection, and so more steps are needed to be taken in order to protect future infected individuals. A way to help is breaking the transmission cycle on the disease, sometimes in more than one places. As you can see on this picture that is on the screen, the reservoir has a portal of exit which goes into an agent. The agent finds a portal of entry which goes into a susceptible host, and the susceptible host transmits from person to person, which then goes back into a reservoir, and it is a never-ending cycle. To break the transmission cycle between the vector and the host, a vaccine was created as a preventative form of medicine. A preventative form of medicine is thought to be more effective than the antibiotics, for symptom-treating medication was obviously not what these patients needed in order to survive. Our plan in order to control and create a vaccination will begin with the generation of an antigen which will be introduced as an immune response. Next, we will isolate the antigen, and then we will purify the antigen by the insertion of the adjuvant, which is an increased immune response to the antigen. Once all the components are mixed together into a single syringe, it will be packaged for delivery. After the vaccination is ready, it will be administered in areas in which the disease agent is common, aka mid to northeastern US, and particularly cold areas surrounded with water in Alaska. Those traveling to and from Alaska or some of the regions that I had mentioned before should also be vaccinated, as this is a high-risk location for the contraction of the disease. Individuals should receive vaccination 10 days prior to traveling to assure that it works the way it's supposed to. Other control methods that we came up with include spraying backyards with mosquito control spray. There are various forms of this spray, and they're all easy to obtain at your local grocery stores. This will decrease the amount of reservoirs in the yards, lowering the chance of transmission from reservoir to vector. Also, keeping water in backyard surrounding areas at a minimum. If there is standing water around one's house, make sure to either treat the water with a bacterial insecticide or dump it into the ground. This keeps the mosquito larvae population at a much lower density, assisting in decreasing the chances of having infected reservoirs. Rake and keep grass short. Mosquitoes enjoy areas that can be kept moist. Raking excess leaves and cutting the long grass allows the sun to dry out the ground and allow for less ideal places for mosquitoes to lay their eggs. Keep bird feces clean if an area that an individual can easily come in contact with. Spraying down porches, tables, chairs, and other outdoor furniture, and clean with common household disinfectants in order to maintain the areas clean and sanitary, and there will not be future infection in those areas. Our implementation scheme includes local clinics and hospitals that will offer the vaccination, especially in highly populated areas of the vector and reservoir. This will be an optional vaccination, but should be stressed of its importance to risky individuals, especially those that are old, young, immunologically compromised, and pregnant. Local clinics, grocery stores, and newspapers can educate the general public about ways to decrease the spread of the disease in cost-effective ways. Where to find the proper bug spray for themselves, spray the yard, water treatments, how to clean up bird feces, and keep birds away from the surrounding areas. Contact Alaskan cruise lines to encourage travelers to get vaccinated, as they will be traveling in high-risk areas, and this can be brought back into the continental U.S. So in conclusion, at preventing future outbreaks, we must use vaccinations, reducing standing water, spraying yards, educating the general public, wearing protective clothing, and keeping our yard clean to ensure healthy people all over the United States.